We know it comes off the thoracolumbar fascia here as well as across the iliac crest, and it has occasional attachment points to the inferior tip of the scapula. An easy way to remember its insertion in the bicipital groove is just remember that it's a floor between two majors. And what that means is it goes into the floor of the bicipital groove, and then you have the teres major medially and then the pec major on the lateral side there. For this muscle test, we'll bring the patient's arm out to the side. Again, any seated positions will get her to stabilize with the opposite arm. We know it's an internal rotator and an adductor of the humerus, so we'll get her into that position there. And now I'm going to try and actually move your arm just in a little bit. I'm going to try and pull your arm out, and don't let me do it. So we slowly load in to see the contraction of the lat fibers all the way down here and slowly relax. So again, keying on this area because we know that's where it runs. Hold there nice and strong. Key thing to remember for this one is it's easy for their elbows to bend and recruit other muscles. Very important for the lat muscle test that we keep this elbow straight. Hold there nice and strong. And then slowly relax. Now we'll show you that from a forward-facing position. We'll have the patient spin around and we'll do the opposite side. Good. So stabilize on the shoulder, bring the arm out about. This is pretty much the same position as a supraspinatus where you'd go in from this position, but now we're just going to pull out, make sure that elbow's straight. Hold there nice and strong. And then slowly relax. Let's move her into a supine position. This can be done just as easily in a supine position. And again, we'll bring the patient's arm out to the side, make sure she's internally rotated. Again, make sure that elbow's nice and straight. And then hold there. Nice and strong. Good, good, good. And slowly relax. Where it starts and where it goes. So we know it starts at the EOP, all down the cervical and the nuchal ligament, and then it runs from about T1 all the way down to T12, and then it makes a big fan all the way back. Now, my anatomy teacher, Dr. Nick, wanted me to put this in there because it's a really good way to remember where it attaches to, and it's just a gang. The next muscle we're going to cover is the trapezius muscle, so let's first review where it starts and where it goes. So we know it starts at the EOP, all down the cervical and the nuchal ligament, and then it runs from about T1 all the way down to T12, and then it makes a big fan all the way back. Now, my anatomy teacher, Dr. Nick, wanted me to put this in there because it's a really good way to remember where it attaches to, and it's just a gang sign where you put your thumb on the clavicle, middle of your hand on the acromion, and then the back finger wraps around to the spine of the scapula. Okay? He likes to do it when he teaches. He thinks it's really cool. It is a good way to remember this insertion for this muscle because then we know it's coming to the spine of her scapula, the acromion, and then down to the lateral third of the clavicle. Now, there's three separate divisions for the trapezius. So we have the upper portion, which most people associate with, this big one up top here, and then we have the middle and then the lower. We all do slightly different functions, so when you're muscle testing these, you have to make sure you're challenging the fiber directions that you want to go after. So let's start with the one up top. To fully shorten this muscle, we'll get her to shrug this shoulder up, and then we're going to bring the EOP a little bit closer and back just a bit. So now we know that muscle's in its tightest, most short position, and this might not be the best view, but I'll show you how it's going to be done. And just because this table's a little bit high, I'm going to put a knee up top. I'll place my right hand on her shoulder, and then my left hand's going to be gliding away, but I don't want her to let me move her in that direction. So hold her nice and strong. I'm trying to push her shoulder down and her head away, and she's contracting her upper trap in order to prevent that from happening. So let's see what that looks like from a different position. We'll do the other shoulder this time, so we'll get her to shrug this side up. We'll bring her EOP just a little bit towards and back. I'm going to place my left hand on her shoulder, try and push down, and hold there nice and strong. So again, we're trying to separate these 2 points, and this muscle is contracting to prevent that from happening. This isn't...
You're also engaging when you get her scalp with it.
Okay, yeah. And up again. So from this position, we're getting a good challenge on the upper trapezius. Keep in mind your levator scap is firing a little bit as well. We'll show a little bit more of a specific muscle test to really isolate that one in a little bit here. So the next muscle we're going to go into is the middle trapezius, which is a retractor of the scapula because it runs between the middle borders of the scapula. So we'll go arm out to the side, and we'll do thumb in neutral, and she can do a little bit of external rotation there. And then what I'm going to do is try and move her arm forward, and she's not going to let me do that. So I'm just going to slowly load, 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 and then come back out. For the muscle test for the inferior fibers of the trapezius, we'll move the patient's arm right up into this position, slight external rotation. And we know it's coming off the spine of the scapula, running down into the lower T-spine. I'm going to, again, apply a force forward, and she's going to resist that motion. Hold her nice and strong. Now, with respect to testing these muscles, what you usually find is these ones, the upper fibers, are usually quite strong, over-contracted in a lot of people, and because of all the sitting and poor posture, the tightness in the actually anterior part of the shoulder can actually turn off the middle and inferior fibers. So come up again on this side. You'll get usually a pretty solid muscle test when you check the upper fibers, and then when you check these middle and lower fibers, you're not going to get as strong as strong a firing. So I just want to just bring that to your attention, because a lot of people will always just isolate traps up here. Two separate divisions, and you usually get quite a different response when you do muscle tests in them. All right, now I'm going to show you guys a variation for a middle trapezius fiber muscle test in a prone position. So we'll move the patient's arm out to the side, slight external rotation. And I'm going to try and move your arm down. Don't let me do it. And I'm just going to apply a little bit of palpation directly over top of those middle trapezius fibers. And note the functional kinetic chain from the middle trapezius all the way through posterior delt, and as well as a little bit of triceps engaged to resist this motion while we do this muscle test. And in this position, if we want to be even a little more specific on the middle trapezius fibers, we can go proximal to the elbow and do another muscle test there just to see what kind of response we get. Moving into the inferior fibers of the trapezius, we'll do slight external rotation again. And again, we know those fibers are running all the way down here. So again, I'm just going to apply support force there. I'm going to try and push your arm down. Don't let me do it. And again, I can feel that contraction directly beneath my fingers when I do a little load in with the muscle test. And you guys might not be able to see this on the camera very well, but notice I can clear my hand underneath her arm. Her arm is not resting on the table, it's just slightly off, so she's working pretty hard right now just to hold this position. But that's how we do a proper muscle test, because if you just relax down, if I just push into the table, I'm getting no useful feedback, and these muscles have turned right off. I can feel there's no activity there. Lift your arm back up, boom, and they fire right underneath my fingers. Hold there. And that's how you do the inferior muscle test. Just also want to remind you guys that when testing the muscle fibers for the trapezius in the middle and lower position, where the thumb is can actually change how that muscle fires. Now, of course, we know it doesn't originate or attach to the humerus at all, but for some reason, when we get external rotation, you just get a better firing and contraction of this. So when you do your muscle test, you probably want to make sure the thumbs are up in this position, and as you go down, it actually might be more indicated when you do a rhomboid muscle test. So let's keep the thumbs up when doing the middle and inferior fibers for the trapezius. And it's also something that's done quite a bit as a rehab exercise on an exercise ball, and it's called YT's deltoid. Now we know the anterior deltoid comes off the clavicle here, goes to the deltoid tuberosity, and then the intermediate or the middle fibers of the deltoid are coming off the acromion down to the deltoid tuberosity, and then the posterior fibers are coming off that spine of the scapula. It's actually the same points that the traps insert onto is where the deltoids originate off of. To isolate each one of these three groups, we'll bring her arm up. And now if we want to do the deltoid, we know it's primarily obviously the anterior fibers. We're going to support, actually not too far out on this shoulder, support mid-spine with my supporting hand, and I'm trying to pull her humerus back towards me. And you can see the contraction of the anterior fibers right here. So we slowly load in. Again, the pec's firing a little bit as well. The middle fibers, arms in the same position, and I'm just going to go straight down with my force. And same thing with the support. We can even go same side with the support hand. Good, and again, you're seeing the fibers contract right there. For the posterior fibers, we'll do a little bit of internal rotation because it's going to sort of be an up and back motion that I'm going to be getting her to do. And then we slowly load in to fire the posterior deltoid. Let's do it from this position now. We'll start with the anterior fibers. So again, we'll support here, and it's going to be bringing her arm forward. So I'm going to try and push the humerus back. Again, you can see the contraction of it right there. For the middle fibers, I'm going to push straight down, which is going to be all through here. And then for the posterior, it's kind of, this is the motion for her where it kind of goes from here all the way up and back. So I'll support here and then lock right there, and you can see all the fiber contraction through there. And always loading in slow and coming off slow. So that's to get all three divisions of the deltoid muscle. We're going to go through a supine variation for all the divisions of the deltoid muscle. So what we'll do is we'll take the patient's arm up to 90 degrees here. And I'm just going to support directly actually over top of the deltoid fibers, because then when I test each specific segment, I'll be able to feel contraction beneath my hand. So let's do the anterior division first, and that would be pushing the humerus down into the table. So you slowly load in, and I can feel those anterior fibers, and you can see them quite nicely here. Relax. And now for the intermediate or medial deltoid, again, that's going to be probably the midpoint of my fingers. I'm going to try and push your elbow down the table. And again, I can just feel that muscle contract right up underneath my fingers, and relax. And then for the final one, the posterior, I'm going to be lifting the humerus up off the table. Let me just get my fingers behind there, relax down, and hold nice and strong. Don't let me move your arm. And I can feel the contraction right up on my fingertips of the posterior deltoid. Another variation for the middle deltoid. This isn't the most strong position to do a muscle test from, because we want to get that elbow coming down the table. So sometimes if you just switch your grip into more of a... We're going to cover of the rotator cuff is going to be the infraspinatus as well as teres minor. So we know the infraspinatus comes off the infraspinous fossa of the scapula, and then it runs to that medial or middle facet on the greater tubercle of the humerus, and then the teres minor is coming off right below it to the posterior facet on the greater tubercle. We know they're both involved in external rotation, and to start the muscle test for these, we'll keep the arm right down in this position, and I'm going to support the elbow with my fingers here and sort of cup. And then I'm going to try and internally rotate her, and she's going to rebound with an external rotation. That'll actually check teres minor best down in that position. We bring the arm up into this position with a little bit external rotation. Hold there nice and strong. That's going to be the first part of infraspinatus, and then we can bring it up in this position and again do it again to check those different fibers all along that infraspinatus muscle.
It's ribs 3 through 5, and it goes up to the coracoid process here, and it's involved in a sort of protraction and downward rotation action on the scapula. So for the muscle test here, we will go actually cross body for this one. We'll pick up the patient's arm nice and straight, wrist relax, and then we'll just get them to lightly place their hand across my bicep, and I'm going to scoop and lock into the coracoid as well as the posterior part of the shoulder, and we'll get you to lift your shoulder right off the table nice and hard. Okay. Don't let me push your arm down, hold her nice and strong. And that's a very specific test for the pec minor. Now we also know that the serratus anterior is also a muscle that's involved in protraction. So yes, you're probably going to fire a few fibers with that muscle test of the serratus anterior. However, that's a good way to isolate the pec minor.
We're going to talk about the subscapularis. So we do know it's an internal rotator. And there's two other internal rotators we want to pay attention to, and that's the pec and the lat. To review the origination point for the subscapularis, we know it's on the subscapular fossa of the scapula, and it comes around to the lesser tubercle of the humerus. Now, arm out to the side for me for a sec. We know that lesser tubercle is way up in our armpit, and we wouldn't recommend that you go palpate into that area. There's a lot of neurovascular structures that we want to be aware of. But for an easy muscle test in this position here, what we'll do is bring her into slight internal rotation, and then I'm just going to support her elbow, and I'm going to try and pull her wrist out towards me, and that activates, yes, subscapularis mainly, but again, you're going to get a bit of pec and lat involvement with that. To isolate this muscle even better, what we'll do is bring her arm behind her back, and we'll flip her around in a sec to show a posterior view, but this is what it's going to look like from the front. Of course, if there's shoulder pathology or problems in doing this, this may be a difficult position for the patient to get into, but it's statistically a really good way to isolate the subscapularis muscle specifically. And then what we'll do here is it's called a lift-off test, where they just lift only their hand and wrist off the small of their back without doing too much extension of the humerus. If the humerus is extending backwards too much, we know the lat has come into play too much, and we're not being as specific as we want to be. So for the posterior view, let's have the patient swing around. When we have the patient in the lift-off position, I just want to review the palpation once more. So support hand on shoulder, her hands on the small of her back there, just nice and relaxed. And then what I'll do is just slide my fingers right in. And then I'll get her to lift off, and you can see how it just pushes my fingers, and I feel the contraction on my fingertips each time she does the lift-off test. So we're getting good strength from that muscle. Keep in mind we have to push through the trapezius, the rhomboids, as well as serratus anterior a little bit, and then the deepest one I hook into and feel contract is that subscapularis. Go ahead, lift off one more time. Good. And if we're going to palpate and approach this muscle from the other side, or the lateral part of the scapula, we're going to find that lateral border, and then I got to get the lats out of the way and come right in to it there. And then push your hand on your stomach for a second, do a little contraction for me. Good. So again, you can just have them place their hand on their stomach in insertion. So we know this long head is long for a reason because it actually starts up in the shoulder, the infraglenoid tubercle. And then we have the deep head here, and then the lateral head here. The lateral head starting above the radial groove on the posterior humerus with the deep head below the radial groove on the posterior humerus. All of them sort of inserting right into that olecranon down here, the tip of the elbow. Okay, relax for me there. So to muscle test this, what we're going to do is bring the elbow to 90 degrees. And a really easy way to spare your body and get a good palpation at the same time is just have them hold there nice and strong as you slowly lift up and palpate across all these muscles. And I can feel them all engage right under my fingers. I can walk up and down the muscle to see if there's uniformity with the contraction all through. Check out the deep head, the lateral head, the long head, slowly load off. So just to review that muscle test for the triceps in a slightly different angle here, this is actually going to be really useful for smaller practitioners that have a hard time generating force against a powerful muscle group. Just going to cup around the wrist like that, palpate across the back of the tricep, and then slowly lift your body weight up while palpating through the muscle and all the heads of it. You can get an appreciation of how strong this muscle group is. If I just keep lifting, he's just going to come right up off the table as he keeps fighting me. And some other ways to do this would just be standard position like this. It would be very similar check for the brachioradialis where I'd pull the wrist down, but now I'm actually just going to push the wrist up. Same kind of thing. I can still palpate out back with my fingers. Again, it's more just the distal fibers I'm checking with that, but a really nice way to do it as well if you have the strength to do it. Just to show you guys a little bit of a variation on the triceps muscle test, you can look specifically at each of the heads. So in this test position with the elbow at 90 degrees, we're going to have a thumbs in or a pronated position on the wrist, and then again I'm slowly going to load in. And this will check primarily the long head. Of course, the other heads of the tricep are involved. If we move the wrist to a neutral or thumbs up position and do a resisted challenge there, this is going to be a little bit more of the deep head of the triceps. And then finally, if we rotate the wrist all the way out into a thumbs out or supinated position, this is going to check the lateral head of the tricep. It has two heads, the long head and the short head. The short head coming off the coracoid process, which is right beneath my finger here. And then the long head is a superior attachment to the glenoid labrum. And then their insertions are down, one on the radial tuberosity and then one into the aponeurosis, which we'll be able to see a little bit better when the patient brings the arm up like that. And just do a little bit of resistance for me. So we can really see good definition of the tendon here, and then the aponeurosis is actually going to fan out here, and you're going to have some fibers of the bicep connect down there. For the muscle test, there's various positions we can do this in. Let's start with just a very general one. So I'm going to support underneath his elbow with my hand, and I'm going to cup just across the wrist here, not across the hand, but across the wrist. And then from here, I'm going to try and pull his arm down, and he's going to do a resisted motion just like that. So this is challenging flexion. Now we do know it's an elbow flexor as well as a supinator, so if I want to make this a little more specific, I can pull down as well as try and rotate his wrist inwards, and he's going to have to rebound and rotate his wrist outwards. That's going to challenge supination and flexion at the same time. Now that's very specific and useful to check the short head. If we want to get a little more specific for the long head, what we can do is bring his arm up and across his body like this. This is the testing position. This is also known as an O'Brien's test, and this puts a lot of strain and torque through the biceps long head. So when I slowly load in like that, you can see the muscle quivering and it challenging specifically those fibers. Now, some things we're looking for with that muscle test is pain deep inside the joint if it's pulling on that superior labral attachment, or potentially you might have some pain across the muscle fibers of the long head. Another variation for that one is because we know the long head crosses the shoulder joint, so it also does a bit of shoulder flexion as well. So we can bring it up into this position, support across the front, and then load down slowly and challenge the muscle that way. Another variation on O'Brien's is you can do a little bit of supraspinatus involvement to see if there's any impingement going on between the supraspinatus and the biceps long head tendon, and then you're going to slowly load in sort of down but also across the front of his body. So we're going to show you guys a supine version for a biceps muscle test. So what you're going to do is bring the arm to about, or in the elbow to about 90 degrees. And now make sure when you're contacting the wrist that you're not doing a tight grip, because in this position the patient actually won't know if I'm pushing this way or if I'm pulling this way. So to bring that thumb around the front, now they know for sure I'm going to be pulling their arm down. I'm going to support underneath the elbow here, so hold there nice and strong, don't let me move you. and slowly build tension. Now again, this is mostly challenging flexion, but what it can do is do a little bit of pronation challenge at the same time, so that he has to supinate. And there you see really good. It comes off the transverse processes of C1 through 4, and then it does a spiraling action down here to the superior medial border of the scapula. For palpation on this, we know the trap is the superficial muscle here right under my hand, so we have to get that out of the way by coming right in front of it here. And notice this line, you can see this faint shadow, that's sort of the outline of the trapezius muscle. What I'm gonna do is come in and lift that muscle out of the way, and then palpate deep to that and get him to lift his shoulder up. And there I can feel the contraction of the levator scap muscle coming all the way down through this area here, and relax. What I can do is, one more time, just get my fingers out of the way. That's how deep, notice how deep this finger is. My thumb is pretty much buried all the way through the trap, so I can get to that levator scap. Okay, good, relax. Now for the muscle test, I might block the view a little bit for this, but we're gonna show you a variation in a second here. So what he's gonna do is lift right up, good, and he's gonna come towards, that's gonna get the origin and insertion really close. Then what we'll do is get a knee up on the table. I'm trying to push this shoulder down and tip his head away. Slowly load in and slowly load out. Good, so for another variation of that, we'll have him spin around. This might be a little bit more of a biomechanical advantage to do it this way. Again, shoulder up for me, good. Bring the origination point nice and close. And again, get right up top, and you're trying to split those two and bring that shoulder down. Notice how getting up on the table allows me to put my weight through my hand, because this is a big, strong muscle group you're checking. To distinguish this from trap, because they share similar actions, in this elevated position, the only difference is, so I'm going to do that to check trap, because now you've brought the EOP closer, and you've approximated the origination and insertion of the trapezius, and brought the levator scap away. So this will be a bit of a better check for the upper muscle test for the subclavius. So we know it's a very small muscle that runs from the first rib to the clavicle, and it actually does have some clinical relevance for an unstable AC joint, okay? If the joint hasn't been rehabbed properly, if the clavicle is unstable, you're gonna have some instability in that area, and that muscle is not gonna be functioning correctly. So for this muscle test, we'll have the patient bring the arm way up top, wrist nice and relaxed, and I'm gonna apply a force that's out and just a little bit forward. Now again, we're going to get some contraction, as you can see, of her pec, of her anterior delt up in this position. Absolutely, you're going to get that. However, this is a pretty good challenge on the subclavius muscle. And if that AC joint was unstable or there was pain in the shoulder, that muscle would rhomboid minor and the rhomboid major. So let's just quickly review the origin and insertion. So know these originate from C7 and T1, and that'll go to the medial border of the scapula here. That'll give you the rhomboid minor. And then T2 to T5 is going to give you the rhomboid major muscle fibers. And they kind of are on an angle in this direction here, or on the opposite side like this. For this muscle test, we'll bring her out to the side, and we just want to actually really get a good look at what happens when we go between internal and external rotation with the patient here. So this is going to be the muscle test position for the rhomboids, but remember that when we did the muscle test for the trapezius, we get a nice external rotation. Notice how the muscle fibers change and the scapula rotates each time we go back and forth between internal and external rotation. So that would be your muscle test position there. And arm up just a bit for the middle trapezius. But for the rhomboids, we're going to bring the arms down just like that. And you can hold there nice and strong. Now if you want to do both at the same time, we'll get both arms out and do a nice retraction, hold nice and tight there, good. And I'm just going to do a cross bilateral contact and slowly load in. Don't let me spread your scapula apart. And just hold, and then slowly come back out. The rib cage to that anterior medial border of the scapula. So in a seated position, we'll get her to move her hand out to the side just to provide a little bit of support, because the muscle test I'm going to do is going to have some force pushing her in this direction. We'll pick up the arm we're going to be testing into the scaption plane, which is about 30 degrees here. And this is going to be a muscle test that involves about 20% with this support arm, and then the remaining 80% is going to come into the lateral border of her scapula, okay? And I'm going to try and force her lateral to medial, and she's slowly going to build resistance back against me. Notice how I've hooked my elbow into my hip. That way I don't actually have to just use my upper body to muscle it, but I can actually just lean my body in once I'm up against her scapula. And as I slowly lead in, she pushes back with her serratus anterior. Good, and relax it. For a posterior view, we'll turn the patient around. And I will be doing the exact same thing on the other side. So support with the opposite hand. We'll bring the test arm out into the scaption plane, which is again is about 30 degrees here. And we have the lateral border of her scapula, which I'll be contacting sort of with my thenar and hyperthenar eminence. Make sure to again hook that elbow right into your hip. And then I'm slowly gonna load in and she's gonna resist that motion. Hold there nice and strong. And I can feel the pressure build as I load in more, and then I can slowly load back. For a variation on a seated muscle test for the serratus anterior, we know it attaches to ribs 1 through 9, so we can actually check each specific area. If we start right at the top here, and then we'll palpate in, because we know the attachment points are right underneath my thumb, and I can check specific rib segments. So I'll hold there nice and strong, and you can feel the contraction lower a little bit. Each time, go down again. And again, you can do 9 separate test positions, down again, to see, is one area locking better than the other? Sometimes you maybe didn't get the best result on a global muscle test of this muscle, and this is a good way to just kind of work through all its range of motion and see where is it stabilizing and where is it not. And then we can go right down to about there, hold there. Again, while palpating with your thumb, you can